Welcome back. It's time for Doc Talk, my friends. We started this new weekly segment here at KSAT so that you can ask doctors health questions. It could really be anything. Joining us now live in the studio is Dr. Leo Lopez. He is the medical director and primary care physician with University Health. Welcome.
Happy to be back. Thank you.
Yeah, thanks for coming back. Okay, so this is a segment all about viewers' questions, and we take them to you. So our first viewer up tonight is Elizabeth M. First of all, I want to say, Mama, hang in there. She's asking, do you have any advice on how to treat colic?
Yeah, thank you for the question. And managing colic can be a really stressful time. So I think grounding us in some terms, we can think about colic generally as when your baby is crying for no apparent reason for 3 hours or more. 3 days or more out of the week, typically in infants 3 months or younger. And so the first thing to know is that this is common. And the other part of it is to have some self-compassion. So one important strategy is if you have a partner or a trusted friend or family member, working with them to ensure that they might be able to cover, do some babysitting, so to speak, so that you can take some time to recover for yourself, because this can be a really overwhelming time. It's also important to know that there's not anything that you're doing or not doing. If this is truly colic, that doesn't mean that your baby is sick. And there's a few other things to keep in mind, and they're worth trying. They're related to feeding and soothing. So on the feeding side, if you are bottle feeding your baby, you might try using a bottle that has one of those collapsible bags. That's one thing you can try. If you are breastfeeding your baby, I might suggest connecting with a lactation specialist to try and change or consider changing the technique. Again, there's not a lot of evidence or research behind the effectiveness of these things, but they're fairly safe to try, and then always ensure that you continue to go to your doctor for the regular checkups.
And so the changes in feeding, is that because you're just trying to minimize the amount of air that a baby is taking in during feeding times?
That's the thought of it. It's not well understood, the underlying mechanisms, but that is kind of one of the thoughts behind it. There are other things that one can try too on the soothing side. So you might try picking up your baby or going for a ride in the car, a walk in the stroller, or trying a warm bath. And again, these are things that are fairly safe and easy to do at home that you can try working on today.
Yeah, a ride in the car can do so many wonders.
And to Elizabeth, we hope that it works out for you.
Yeah, absolutely.
And now here's a question from Donna D. She's asking, will apple cider vinegar help lower blood sugar and A1C? I know this is sort of touted as a natural sort of remedy.
Sure.
Does it work?
Donna, thank you for the question. And just to kind of go off of Dr. Cobb's segment last week on Doc Talk, we think about the hemoglobin A1C as that report card. It tells us how well our blood sugar control has been over the past 3 months. And so, currently using apple cider vinegar is not an effective way to control your diabetes or the hemoglobin A1C. But there are other things that you can try today to try to take steps to better manage your blood sugar. One is to try and eliminate sugary beverages like sodas, lemonades, teas, juices. Try sticking to water. This is always a good option for us. Try to eliminate processed foods, things like fast foods. Try eating and preparing your food at home and having a wide variety from fresh fruits, fresh vegetables, and whole grains. And if you're someone who prefers more of a structure, I'd suggest speaking with your doctor or a registered dietitian about things like the Mediterranean diet or the DASH diet. Those have been shown to be helpful.
Okay, next question from Cynthia G here this evening. She is asking, are there any effects seen in breast cancer and getting the COVID-19 vaccine?
Thank you for the question, Cynthia. So currently, what we do know is that patients that do have cancer are some of the folks that would stand most to gain from the COVID vaccine, because we do know from the research and the studies that over the course of the pandemic, folks with cancer had a higher risk of getting severe COVID, meaning they could end up in the hospital. So I know that there have been kind of these rumors and myths out in the community about the vaccine impacting breast cancer treatment, but there's no evidence to suggest that. So definitely something to consider and to keep in mind for sure.
Okay, now this next question is from Michelle C., and she's asking, where can I get both meningococcal and the Hib vaccinations? And she's saying that she can only find one of the meningococcal vaccines.
Thank you, Michelle. So, it sounds like the vaccines have been either already ordered or recommended. It sounds like there might be an issue with supply. The first thing is to check back with your doctor in the clinic who ordered them. Other places that you might consider trying is calling to any number of local pharmacies to see if they have stock available. Another resource would be Metro Health with San Antonio, checking their website and looking for their contact information to ask about these. And then another place might be the Texas Department of State Health Services. They might have some other resources for you as well.
Okay, so some options out there. Our last question is from Raul tonight. What are the risks of having severe fatty liver?
It's a really important question and some points for us to discuss. So having a fatty liver is actually really common. In fact, this affects 1 in 4 people across the world. And one of the main risk factors for getting a fatty liver is the condition of obesity. And so this also impacts patients who have diabetes. In fact, up to 70% of patients with diabetes have a fatty liver. And up to 40% of those patients will have a very severe version of fatty liver, which I think the questioner might be asking. So the risks of, or the dangers of having that severe form of fatty liver is that can actually progress to things like cirrhosis and liver cancer.
Wow.
But the good news about treating or managing fatty liver, particularly on the more mild side, is that it can be managed and potentially reversed through a lot of the topics that we've talked about. A healthy weight loss, aiming to lose 5 to 10% of your body weight, adherence to the healthy diet like we've discussed, having at least 5 servings of fruits and vegetables every day, trying to limit the fast food intake, regular exercise. So for adults, that means trying to find 150 minutes of exercise in a week. That adds up again to about 30 minutes a day for 5 days. And through that weight management process, we can see some benefits for fatty liver. So definitely appreciate the question and grateful for your time.
All right, Dr. Lopez, same to you. Thanks for being here this evening. We appreciate it.
Definitely. Thank you.
All right. We want to remind people at home, though, send us your questions. We do this every Thursday. So you can go to ksat.com, search for Doc Talk, and let us know what you want us to ask the docs next week.
That's right. Your questions drive this segment, and we very much appreciate your questions. Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.